Hello friends, this is Nishant. I am here with a new video, and in this video what I would like to talk about is about United States clinical experience, that is elective or observerships. I want to talk with perspective of letters of recommendation and learning perspective. So without any delay, let's get started. Now, what I'm about to advise are just my personal views, and they may not be ideal, or they may not, many people may not agree with them. So, I would like to hear from you guys as well. But whatever I did during my electives, I followed these, and they worked out pretty well for me. I mean, I got very good learning experience, and I got some letters of recommendations as well. To begin with, I would like to talk about United States clinical experience. So, what is United States clinical experience, or USCE? USCE is basically a concept in which you go and work at a US hospital to gain exposure to the United States healthcare system. Now, it can be of many types like sub-internships, like clinical electives, research electives, observership, and externships. I have noticed that most of the international medical students and international medical graduates do electives and observerships respectively. So I want to keep the focus of my this video on electives and observerships. So what is an elective? In elective, what you are doing is you are a visiting medical student. So you function as a medical student. So you have a significant amount of patient interaction. You can do physicals, you can do take history, and you can put notes at most of the places. At many places you get to put your notes, and they are recorded under your name, and it's pretty much hands-on. So what however, it needs to be done before graduation. So you have to be a medical student while doing an elective. So you should not have completed your medical school. So if, for example, if you are from medical school in India, you have to do an elective before your internship ends, and so on. So it is important to remember that electives need to be done before graduation, and observerships can be done after graduation. However, the thing about observership is that you don't get a significant amount of patient interaction. That is, it is not hands-on. That is, you most of at most places they don't allow to do history and physical examination on the patient to observers, because as the name implies, you are just shadowing a physician. So the thing about observership is that it can be done after graduation as well. So if you want to add to your USC after your graduation, it can be done in the form of observerships. So these are two basic modes of obtaining United States clinical experience. As I previously mentioned, there are others as well, but these are the two that I noticed were most commonly done by international medical students or graduates. The second question is, how important are electives or observerships during your residency application? Number one, if you are planning to do a residency in United States, it's very important to get used to the healthcare system. Electives and observership provide a very good opportunity to do so, so they are important. Number two is, during your residency application, you need a designated number of letters of recommendation when applying to the programs, from preferably from US physicians. So electives and observerships provide you with opportunity to do so as well. And lastly, USC requirements. So many programs have requirements of at least 2 to 3 months USC. Now, again, it's not each and every program, but many university programs that I have read about have some requirements like you need to have 3 months of USC, or you need to have 2 months of USC, and like that. So with this perspective, with these three perspectives, elective and observership carry a lot of weightage in your residency application. How important are letters of recommendation for your residency application? So they are important for three reasons. Number one is, they are required for your residency applications. Like, ERAS requires you to submit a designated number of letters of recommendations to be applying for the residency programs. So it is important. So number two is that they talk about your work ethic and your punctuality, your sincerity, which are really hard to assess by means of any exams. And the last point is that the letter writers, they are pretty experienced people, and they have seen a lot of people like us, a lot of medical students like us. So they know exactly what they know how to assess and endorse us for the residency programs. So, if you are a real hard worker and a honest person, it will be really beneficial for you if you get a strong letter of recommendation. Now, these are a few tips and tricks to make the most of your rotation, to maximize your chances of getting a letter of recommendation, and to utilize your rotation as a very good learning opportunity. Again, none of these guarantees a letter of recommendation, as it depends on a lot of things, like it depends on the attending, it depends on how much time you are rotating with him or her, and a lot of other things. But if you follow these, I think it will create a good impression on the attendings, and it will maximize your chances of getting a letter of recommendation. Number one advice that I would like to give is to present multiple cases. So what happens if you are doing an elective? What you get to do if you are in an inpatient settings? What you are supposed to do many times is to take the cases, study them, and present them to the attending who rounds usually in the morning. So how I used to go about it is the inpatient round usually used to start at 8 a.m. in the morning. So what I used to do is I used to go at 6 a.m. and I used to take the case in 30 minutes or so. Then I used to prepare my presentation for half an hour. I used to formulate assessment and plan for that patient, and then I used to present the case to the resident who used to give me his or her recommendations, and that used to improve my presentation skills and my clinical acumen. So it is very important to present multiple cases to your attending so that they can assess you better in a way that they will be able to endorse you. So it is very important to present multiple cases. Then the second point is to be on time always. Being on time is taken as very positively, or perhaps being before time is taken very positively, because it shows that you are actually interested in the topic or the discussion that is going on there. It can be a conference, it can be a clinic, it can be inpatient rounds. Being on time is always a positive thing. So it is very important to be on time. Then you may be rotating with many other medical students or many other graduates. So if you are treating them with respect, and if you are treating them really well, it tells that you are a very good team worker. So remember, that is one of the things that the residency directors are looking for. So if your letter letter of recommendation says that you are a very good team worker, that will definitely give you an edge over many people whose letter of recommendation doesn't say that. Again, I am not a residency program director, and I don't know much about this, but whatever I heard from people, that is what I am telling. So it is very important to be respectful to other students as well. Then be enthusiastic. Over enthusiasm can sometimes be beneficial. Now, this is a double-edged sword, and it's slightly controversial point, but how I used to go about it is like whenever an attending used to ask question or he used to assign some task, like one of the attending asked me that how are the ACLS algorithms for the cardiac surgery patient. So I did not know that at that moment none of the my fellow medical student knew. So I volunteered that I don't know it now, but I will read about it and let you know tomorrow. So that gave the attending two clues, that number one, I'm interested in the subject, and number two is that I am willing to work hard. So being enthusiastic can be beneficial. It can be in taking tasks, it can be in answering questions. But again, my next point is very important, like try to answer as many questions as you can, but don't do a lot of guesswork if you don't know the answer. As a doctor, it is very important to understand, or it is very important to know that we can't know everything. Medicine is a never ending science, and it is okay to not, as a medical student, to not know a few things. So once there was an instance when I was presenting a case to an attending in medical ICU, and I said that, oh, the patient's creatinine is this, and it is uptrending. So my attending said that, Nishant, your patient is going into AKI, that's acute kidney injury. What are you doing for that? I'm like, I'm sorry, doctor, but I really don't know what is causing the AKI. He was really impressed by that answer, and he said that, Nishant, it is very important to accept when you don't know, and that quality I like. So accepting when you don't know is a very good, it's taken again very positively, and perhaps is a very good quality. So the last point, and perhaps the most important point that I would like to tell, is to always pre-round. Now, what is pre-rounding? So before inpatient rounds start, many residents, they like to go over the patient once and talk about them. So it is very beneficial if you attend those pre-rounds and you talk to the resident about the cases. That gives you a very good idea, because the residents are of course more experienced than us, and they have a, and they are there for a longer time, so they probably have a better idea of the patient than us. So they can guide us in that perspective of how to present to the attending. For example, once what happened is that I was preparing a case of alcohol withdrawal, and my resident, I prepared the case really thoroughly, and I was really confident about it. So once my resident asked that, Nishant, how much Ativan does your patient get? And I was like, I'm sorry, I don't know that. And I couldn't answer him, but then I went to see the patient's chart, and I saw that the patient got X milligrams of Ativan. So, believe me or not, while I was presenting to the attending asked, Nishant, how much Ativan does your patient got? So, I answered that yes, he got X milligrams of Ativan. And the attending was like, very good, you know that it's very good that you know your case very well. So, pre-rounding is very beneficial. Now, a few more points that I would like to tell. Number one is go early, which is the one and the same thing as what I told in the previous slide, that going on time or going early is taken very positively. Be present for rounds or conferences or clinics. That tells that you are actually interested in the subject. And volunteer to work. It is important to remember that the residents, the fellows, and the attendings are really working hard, and they have a lot of things to do. So if you could contribute by working something for them, if you could contribute by helping them with something, it is always taken very positively. Then perhaps the most important point amongst all these points is that it is absolutely normal to feel lost during first few days of your elective or observership. You may not understand that what is going on around you. So especially if you are an international medical student or international medical graduate, and you're not quite used to how things go in US. So this happened to me during my first rotation. That first week I was completely clueless about the how the things are going on. But during that, I used that week to prepare for my next 3 weeks. So I took help of resident. Few of my residents were really nice. Few of my fellows were really All of my fellows and all of my residents were really nice, and they helped me. And during the second week, the attending said that, Nishant, you are doing a great job. And that felt like a huge compliment to me, because from not being able to present the cases well, to getting a compliment that, Nishant, you are doing a good job, is definitely an improvement. So work hard and get on track as soon as possible. By working hard, I mean, again, presenting multiple cases, taking multiple cases, presenting them to the residents, getting advices from the residents on how to improve, and fellows, and reading the patient in detail. That is what I mean by working hard. Then again, I can't emphasize this point enough, but be respectful towards the attendings, residents, fellows, medical students, and other staff like technicians and nurses. It is very important to remember that they are working really hard to keep the healthcare system going on, and must be respected. So I would like to endorse this. I would like to emphasize this point, that it is, if you respect everyone, it tells that you are a very good team worker, and being respectful towards all is definitely a quality that is admired by everyone. So let's move on to the next slide. Now that having talked about few things that you should do, what things you should not do or you should avoid doing. Number one is taking leave or taking a day off unless it's absolutely needed. Like if you are running a fever, if you are not feeling well, or if you have an exam, then it's probably okay to take a day off with permission of your attending, your elective coordinator, or your residents. But unless it's absolutely needed, I would advise you to be present for as many days as possible, as that gives the attending and the fellow and the resident opportunity to help you in a better way, and perhaps increases your chances of getting a letter of recommendation. Number two, and I have emphasized this enough already, that being on time is a very good quality and it's taken very positively. So you can be late for maybe for a day or two, but being late consistently, probably, even though you don't intend to do so or it's not true, but it probably tells others that you're probably not that interested in the subject or what is going on. So being on time is really important. So the third point is lying about everything, anything. So lying about anything, like for example, if the attending asks that what is your patient's latest hemoglobin, so if you don't know, just say that I don't know, but I'll check and get back to you. It is very important to not do guesswork, because there are others who know the case in detail, like residents and fellows, and if you just take a guesswork, they may interject and tell that I'm sorry, but that's incorrect. The most latest hemoglobin is this. So it is very important to not lie about anything. Like, yeah. So number four is not doing assigned tasks. So if you are volunteer to do some work, like I was once told that I was told to read about indications for exchange transfusion in sickle cell disease. So what I did is I downloaded multiple papers and I started reading them, and I made a small presentation and I showed it to my attending. The attending was actually impressed and she said that, Nishant, it's very nice to see that you are doing your assigned tasks. However, if you don't do assigned tasks, it again tells that you are probably not as interested in the subject as you should be. So it again, being very prompt in doing tasks and following them with in a good manner probably increases your chances of getting a letter of recommendation. Number five is again a very important point, is a very general point. I'm sure most of you know about this, but interrupting someone when they're talking is not taken very positively. So if you have any doubts, question or concerns, you can always raise your hand and you can tell them when they have finished talking. But interrupting someone while they are talking or they are discussing something is probably not a very good practice to do. Then the most important thing on this slide is that it should never demean your country's health system. I know that all countries in the world do not have healthcare system as good as the United States, but it is important to remember that the doctors, the nurses, the residents, everyone, even in your own country and in all countries, like be it in Africa, be it in Middle East, be it in India, be it in Pakistan, be it in Philippines, everywhere they are working really hard to take care of their patients. So we should never demean our own country's healthcare system just to impress someone. I mean, it is very important to not demean your country's healthcare system. Now, a few more things to avoid. Again, these are very subjective views and they may not be ideal for everyone, or everyone may not agree with them, but I just wanted to put them as they have helped me tremendously. Number one, you should avoid talking excessively and expressing excessive emotions. I know, as a doctor, please don't get me wrong, as a doctor, you have to be as empathetic as possible, and you have to understand the patient's emotion, you have to counsel them, but being excessively emotional in front of patients or being excessively emotional in front of attending may impact negatively towards your evaluation. So as a doctor, it is very important to have a stable emotional balance and uh, express your emotions when needed and do not express them excessively. Then The second point I would like to talk is that continually praising someone. You should avoid continually praising someone. I know that there are many experts in this field, and the attending that you are rotating under may be an outstanding physician. The fellows that you are working under may be an outstanding academician, and they can be very good. So it is very important to admire their qualities. However, if you are praising someone continuously, that may give them an impression that you are doing this because you want something from them. So praising someone continuously is not again taken very positively. So of course, please don't get me wrong, it is very important to admire their qualities, but continually doing that may negatively impact your evaluation. Then the third point is again slightly controversial point, but acting as if you know everything. So again, it is very important to understand that medicine is a never-ending science, and uh, nobody can know everything in medicine. So if you don't know the answer, just admit that you don't know, and you should ask questions like, "What do you think is the?" You should always take their feedback and ask them about what is the correct answer and what should be done in this patient. So yeah, that's it. And then fourth and perhaps very important point, I was advised this by one of the very big physicians, that being too stringent about your working hours, especially at the end of day, may not be a very ideal thing to do. Like if you are a medical student and you have been given a time of 9 to 4, and sometimes what happens is the clinics goes on till 6. So what I would like to advise is to stay till 6. Again, please don't get me wrong, I'm not asking you to be overworked or overwhelmed by work, but what I'm trying to say is you should just show that you should always be interested in the subject, and you should try to learn as much as possible. So if you want to go above that, you should, if you want to go next to the average line, this one is a very good practice, that being not being too stringent about your working hours, especially at the end of day. If you are staying late, if you are working hard, the attending notices that you are really willing to work hard. So what happened is I used to attend some clinics which used to start at 8 a.m. in the morning, and they used to go on till 2 p.m. Then the afternoon clinics used to start at 3, and they used to go on maybe till 6 or 7. My working hours were like 9 to 5, but I used to be present for both of these clinics, and what that did was that gave an indication to my attending that I am willing to work hard and I am actually interested in that subject. So it is very important to be slightly lenient about the timings. Now, a few very special tips that have helped me tremendously. Number one is clinics. So, if you are attending clinics of an attending, and if you have access to the patient data, what you should do is you should check out the uh, patient's chart, and you should study them in detail before going to the clinics. If you know the patients beforehand, it helps you tremendously in getting history and formulating a plan. And it also tells the attending that you are actually interested in what is going on. So doing this for clinics helps a lot. So during inpatient rounds, you have to ask one question to the patient, that if they have any questions for you. So for example, I'm sure most of the attendings and almost all of the attendings, and during most of the times, they will ask this question to the patient at the end of their discussion, that do you have any questions for me. But for example, if sometimes if the attending doesn't ask, it is very important that if you ask that question to the patient, it gives a very good indication to the attending that you are doing what we call as two-way communication, that you're giving patient to ask chance to ask questions. This becomes very important while you're appearing for USMLE step 2 CS exam as well. So it is very important to do this. Then something called as mid rotation feedback. What I used to do, I used to rotate with one attending for maybe 15 days. And what I used to do at the end of first week, I used to go to the attending and I used to ask them, what do you think, on which areas can I improve, or how am I doing with respect to my clinical acumen and my presentation skills. One of the attending advised me that, Nishant, you are doing really well when it comes to knowing your case in detail, but however, you're not doing that well when you are discussing the assessment and plan. So what happened is that in the next week I focused on improving the assessment and plan, and the attending at the end of the next week said that Nishant, you have improved significantly and I really appreciate you coming to me and taking my advice. So taking his advice helped me tremendously in improving myself. So mid rotation feedback is again very important. Again, this fourth point is the same as mid rotation feedback, is that you are asking the attending question, how can I improve? Then one of the question that I asked one of my senior attending is, what do you expect from a good medical student, resident, or a fellow? His answer was to be enthusiastic, be on time, and know your cases thoroughly. See guys, you might notice that they don't expect you to be super intelligent or super talented. They just want you to be hardworking. And if you show that you are hardworking, if you are, of course, being knowing the art of medicine in detail, having good medical knowledge is of course a very important prerequisite of being a doctor. But something to note is that more important thing for many attendings is that you are, if you are working hard, if you are interested, if you are enthusiastic, if you are energetic, or if you are uh, if you are working hard, so it's very important to do that. Then number, I would like to club these 2 points to research. So you should always ask attending about their ongoing research and publications. You should read their research and you should read their publication and potentially discuss the topics with them. It gives a very good impression to them, and it also tells that you are more interested in research. So if you plan to be an academician in future, or even if you don't plan to be an academician but you want to do some research, this is a very good step to go about it.